Earlier tonight, we brought to you a special report, Coronavirus Facts Not Fear, Following the Curve. Various issues were discussed, such as wearing masks, the recent increase in cases, and how we can all do our part to slow the spread. Here's a closer look.
We are looking at some of the highest numbers we've ever seen during this pandemic. So today we had 96 positives. Hey, put that in perspective, back in mid-July we had 7. Hey, our record in the spring was 71.
As COVID-19 cases continue to rise, local health officials decided to step in and start speaking out.
What does that mean for our community? Well, that means that our hospitals are becoming more strained. And as we have watched this widespread community spread, that we have noticed that the census in the hospital has increased, and alarmingly so.
And while they were at it, common myths were addressed as whether or not masks work.
Masking is 100% effective at decreasing the spread.
People saying, well, masks don't work. And again, too, that is another myth. If you look at the hospital, particularly Northwest, the staff we have that have contracted COVID are not the nurses who are working on our COVID floors.
Additionally, President Trump said this weekend during a speech that doctors get more money and hospitals get more money when coding a death as related to COVID.
That is absolutely false. There is no physician, there is no nurse, there is no respiratory therapist who is hoping that someone gets COVID so that someone's pockets are lined.
And moving forward, everyone agrees that this disease needs to be taken much more seriously.
Those who get to the level of disease that wind up requiring intensive care and requiring a ventilator is not the same as that 10%. That survival, once you're at that level of disease, is approximately 40% mortality.
And looking forward, Dr. Scott Milton was asked, how can we all do our part to slow the spread?
You can start wearing a mask. You wear a mask more. And I think if everyone were to do that, then we could bend the curve.
And due to today's weather, in addition to all of this, Dr. Brian Weiss says that Northwest, as a trauma center, is having to deal with an increase of trauma patients, even though they are already straining in terms of really not having beds or rooms to put people in.